A very good day to all. Today's topic of discussion is enamel and specifically the microscopic structure of enamel. Enamel is considered as the hardest substance of human body. It makes the outermost covering of the crown of the tooth. What makes it more harder is the virtue of the presence of the maximum mineral contents it has. It is made up of 99% of hard tissue, which includes minerals like hydroxyapatite crystals and other trace elements, and just 1% of organic component, which is enamel proteins. Let's quickly go to the topic of discussion, that is the structure, microscopic structure of enamel. Now, if you look under microscope, there are three important structures which you can see. One is enamel rods, the other one is a rod sheath, and the third one is inter-rod substance or interprismatic substance. Let's go to each. What are enamel rods, or otherwise called as enamel prisms? Now, this is a picture of enamel rods where this picture, the first picture, is the longitudinal section, a longitudinal hard tissue section of enamel, and the second picture shows the cross section of the enamel. Now, enamel rods are cylindrical in longitudinal section. It will look like a cylinder in a longitudinal section, as you saw in the last picture. And it looks hexagonal, more like how you see a squamous cell, those kind of hexagonal sides it will have in cross section. So enamel rods will be looking like a hexagonal crystal in a cross section, and it will look like a longitudinal cylindrical shape in a longitudinal section. Now the enamel rods, from where it extends, is it starts from the dentino-enamel junction towards the surface of the enamel in a tortuous course. That means, enamel, there is a surface of the enamel. Enamel is firmly attached to the underlying dentine, and the attachment place or the attachment junction of the enamel and dentine is called as dentino-enamel junction. And that junction is not flat, it is scalloped. It is scalloped means it is like a wavy joint where the convexity of the wavy joint is facing towards the dentine and the concavity is facing towards the enamel. So that is a peculiarity of a dentino-enamel junction. Now the enamel rods starts from because the enamel deposition start from within the dentino-enamel junction, and the enamel forming cells which are called as amyloblasts, which will move towards the surface of the enamel. So when we tell the direction of the enamel, we will tell it as the enamel rod starts from the dentino-enamel junctions and it will extend towards the surface of the enamel. Okay. And it is not in a straight line. It is in a tortuous course. That means it is slightly wavy. Small waves pole ആയിരിക്കും അതിന്റെ arrangement. It is not straight like a line. It is always tortuous. And the average diameter of the enamel rod is 4 micron. And the diameter increases from the DJ towards the outer surface. Like from the DJ, the enamel starts from DJ there, the diameter is less and it will gradually increases as it goes towards the surface of the enamel. And also the number of the rods varies from 5 million to 12 million. Now, what makes it different? So it depends on different tooth. Say for example, the lower lateral or the central incisor will have the minimum number of enamel rods, whereas the molars, the first molars, the mandibular or the maxillary first molars is supposed to have the maximum number of, because as the size of the tooth increases, the number of rod also increases. So the number of rods is not a definite number. There is always a range. So the minimum range is from 5 million, that is for lower incisor teeth like centrals and laterals of lower jaw, will make 5 millions of enamel rods, which is made up of 5 millions of enamel rods, whereas the maxillary or the big tooth are made up of approximately 12 million enamel rods. and the rods are at right angle to the dentine surface. That means the rods are coming, attaching from the DJ, and it is extending towards the surface of the enamel. And when it is forming from the DJ, it makes a right angle with the dentine surface, or the DJ, it makes a right angle. In the cervical portion and central portion of the crown in deciduous tooth, the enamel rods are arranged more horizontal. Okay, so whereas in the other teeth, especially in the inner part near the DEJ, it is arranged in right angle. Whereas when it comes to the cervical portion of the tooth, the cervical portion of the crown of the tooth, and the central part of the crown of the deciduous tooth specifically, these enamel rods are arranged horizontally, not vertically, which makes a right angle. Okay, and it is oblique in direction towards the cusp and almost vertical in the cuspal tip. So that means when it is going towards the cuspal areas, the perpendicular nature or the perpendicular arrangement of the enamel rods will change, and it will slowly become oblique. It will become little diagonal, it will tilt the direction, and it will become more oblique, and it is almost vertical. When it comes to the tip, the cuspal tip, it is more standing as a vertical instead of being horizontal or oblique, it is more vertical. In permanent teeth, the direction is similar in occlusal third of the crown. So it is almost similar. Everywhere it is going to be similar in permanent teeth. Only in deciduous teeth are slightly different. Otherwise, if you take in permanent teeth, the direction is similar in occlusal two-third of the crown. In cervical region, they are more apical. So when you say the enamel rod is directed towards apical, now the apical portion is referring to the apex of the root, or it is referring to the apical foramen of the tooth. So the enamel rods are directed down towards the apex of the root or the apical foramen of the root. So this is how it is arranged. You can see these are the what is written as E is the enamel rods. You can see it is more perpendicular, and when it is coming towards the cuspal areas, it is becoming more oblique. And this is again, the second picture is again an ultrastructure of enamel, where you can see the enamel and the enamel rods which are arranged perpendicular from the dentine surface. You can see the dentino-enamel junctions. Dark and the light colors differentiate the enamel and the dentine in this picture. These are ultra microscopic picture, and what section we need to see for this enamel is usually enamel is visualized under ground section. The teeth is being taken, it is sliced, and it is grounded on top of the Arkansas stone, and we make into thin sections and look at under microscope. Like a soft tissue, we don't do any HND staining. This is a stainless slide where you will just put the trimmed tooth on the surface of the slide, and you just see under the light microscope, and you will see all the enamel rods. Because if you do a decalcification, because the enamel is made up of 99% of minerals, all the minerals will get diluted in the decalcification medium. So you don't decalcify it, you don't try to make it soft and make it like a routine thin section under microtome. What you do is you will grind it, or you ground it on top of the Arkansas stones and make it into thin sections and look under microscope to see all these structures. Now let's go to the ultrastructure, more detail about the enamel rods. The enamel rods give a keyhole pattern. Okay, so you know how a keyhole will look. It will have a head like a wide area, and it will have a narrow area. If you look into a keyhole of a door, you will see the top portion is going to have a head-like area, and the down portion will have a tail-like area. So the keyhole pattern of the enamel rod will have a head and a tail portion. And the rods are 5 microns. So each keyhole or each enamel rods are 5 micron in breadth and 9 micron in length. So it is more lengthier. So if you look into a keyhole, you can understand from top to bottom the length is more, and it is not more wider when you compare it to from top to bottom. It's okay. So the rods are tightly packed and it contains hydroxyapatite crystal within it. So all the rods will be very, very tightly packed, especially when it is near the DJ or dentino-enamel junction. As it goes up towards the enamel surface, it is going to little bit flare up, but the enamel rods will be, because it makes about 5 million to 12 million, so it is a huge number. So it is always tightly packed. When it's going towards the surface of the enamel or surface of the tooth, it is little wider and loosely placed. But as such, enamel rods, because it is more numerous in number, it is always tightly packed. And each crystals are parallel to the long axis of the rod in the head portion. And when it comes to the tail portion, the orientation of the crystal will change a little bit, and it will change a 65-degree angle. It will change into a 65-degree angle. So what I mean to say is the enamel rod, enamel crystals or hydroxyapatite crystals are hexagonal in shape, and it is always arranged parallel to the long axis of the enamel rod. In the head portion of the keyhole pattern, it is always arranged as long axis, parallel to the long axis. When it is coming to the tail portion of the enamel rod, it will make a little bit angle of about 65. And these are enamel rods. This picture shows how many numbers. It is very, very thickly packed. It's an ultra microscopic structure. And this is what a keyhole. You can see a head portion like this, and it is going down like a tail portion. So you can see a single rods will contribute, or it will contribute to multiple crystals. So a single crystal will contribute to multiple enamel rods. So that is how the pattern is. It will typically look like a keyhole pattern. And if you try to pull out one keyhole, it is going to be like this. This is a drawn picture where the enamel rod is something like this, and it is showing a head and a tail. And the previous picture, you can see that is an actual microscopic picture. You can see how many enamel rods will contribute to each other to make a single enamel rod, or how many crystals will contribute each other to make a single enamel rod. Okay, now moving on to some other ultra microscopic features of enamel, and few of these structures are also considered as hypomineralized or hypocalcified structures of enamel. Going to the first, it is enamel tuft. Okay, now in this picture, if you can see the top portion, this area is called as enamel, which is mentioned, which is labeled, and the down portion where you can see dentinal tubules, it is called as dentine, and the line which is demarcating these two areas, which is the DJ, and as I told you, it is not straight, it is scalloped, where these scalloping or the convexities are facing towards the dentine. And you can see some structures which are projecting towards the enamel, and some of these structures are called as, which is labeled as enamel tuft. Now, what is enamel tuft? The enamel tuft are structures which arises from dentino-enamel junction and extend towards the outer surface. It is not necessary it will reach the outer surface, but it is definitely starting from the dentino-enamel junction, and it is extending towards the direction of the outer surface of the enamel. And it extends to 1/5 to 1/3 of the enamel, not more than that. Okay, it'll go maximum to the 1/3 of the enamel. It will not, these structures will not reach on top and it will go and join to the surface of the enamel. No, it starts from the dentino-enamel junction and it will start extending up. Maximum, it will extend up to the 1/3 of the enamel, that's all. And these structures are considered as a ribbon-like structures, which is resembling a tuft of grass. If you see a grass which is grown on the floor, on the ground, it will have so many leaves which is been projecting in different direction, and it will have tuft like a set of root. So you also will be drawing structure like that. So these are ribbon-like structure which will resemble a tuft, a bunch of grass or a tuft of grass. It is usually seen in a transverse section or a longitudinal section. You can tell, you can see it in a longitudinal section, as well as you can see it in cross section, of course, but it is more prominently seen in longitudinal section. And it is considered as a hypocalcified structure of enamel. And moving on to the next structure, which is called as enamel lamellae, that is also again considered as a hypocalcified structure. Now, these are thin leaf-like structures. When you say leaf, so you are literally in this picture, you are not seeing anything like a leaf. So you are seeing leaf. Why? This is just a section. So if you take a whole tooth as a structure, and if you consider, if you imagine like a leaf, so that means the enamel lamellae is essentially like a crack. It is like a crack which is seen throughout the enamel. So when you consider from the outer surface to inner surface, the crack is there. So the crack is going to be like a flat leaf-like structures. You have to imagine in that way. And these lamellae, unlike your enamel tuft, these extend from enamel surface to the DEJ, whereas your enamel lamellae was starting from DEJ and it was going towards the surface of the enamel, whereas your enamel lamellae will start from the surface of the enamel and it will be coming towards the dentine, and sometimes it will come in contact with the DEJ. It will extend from the top to the DEJ. Sometimes it penetrates into the DEJ. That's the next point. It may penetrate into the DEJ, and it may be confused with cracks in the ground section because, as I told you earlier, now these hypocalcified structures, or per se enamel, any structures in the enamel, can be visible properly only if you make a ground section. So when you make a ground section, when you are trying to make very, very thin section out of your tooth, what happens is sometimes automatically some crack will develop. Okay, because this is a hard tissue, some crack. So that is a crack which is formed due to the ground section. So we don't have to get confused with the crack which we made by doing a ground section, whereas enamel lamellae is a crack which is de novo or by default present in the enamel. That is not because of any ground section. In a living tooth, inside the patient mouth, you can see enamel lamellae. So that is why we are telling you should not confuse with the cracks which is formed by the ground section. Enamel lamellae is something which can be normally seen in an individual in a living tooth. This is also considered as hypocalcified structure. Now you have different types of enamel lamellae. There are three major types of enamel lamellae. The types are type A, type B, and type C. Now what is the difference? Now type A composed of poorly calcified enamel rods. Of course, it is a hypocalcified structure. So type A enamel lamellae, which will contain poorly calcified rod segment in the enamel, whereas in type B, the enamel cracks or the lamellae will consist of degenerated epithelial cells. Now, from where this is coming, it is coming from the saliva, it is coming from the oral cavity. These degenerated cells can get entrapped within the enamel lamellae, and it may extend to the dentine, whereas the type A, it might not extend till the DEJ, but type B can extend. This crack can extend till the dentine. Type C is the lamellae filled with organic matrix. Now these can be organic matrix of enamel, and also these can be organic substances which is seen in the saliva as well, and this also can extend to the DEJ. So now only type A will not be extending towards the dentine. Definitely all the three types are going to start from the surface of the enamel, but it is not necessary that it has to reach till the DEJ, whereas type B and type C has got a chance to reach till the DEJ. It is going to be a through and through crack. Now moving on to the next, enamel spintle. Now enamel spintle is the odontoblastic process. As you all know, what are odontoblastic process? What are odontoblasts? Now odontoblasts or odontoblastic process are seen in dentine. Now this is the functional unit, or this is the living unit of the dentine, where dental tubules contain odontoblastic process and odontoblastic cell body. Now these odontoblastic process, sometimes it is supposed to come and end in the DEJ, whereas sometimes these odontoblastic process may extend from the DEJ and it will enter into the enamel. Once it is extending into the enamel, now it is going to be seen as a hypocalcified structure, because these are odontoblastic process as well as odontoblast as such. It is a soft tissue or it is a part of a cell. So now we are not expecting any kind of cell within the enamel as such. So the soft tissue extension into the enamel will be seen as an enamel spindle until it is considered as a hypocalcified structure. It appears as dark in transmitted light because it is a soft tissue which will just go off when you make round suctions. So now this will make a little bit of hockey stick kind of small projection as you see in this diagram. Now, what is enamel spindle? It is the odontoblastic process which is extending beyond the DEJ and which enters into the enamel. Okay. Now, another ultramicroscopic structure, or it is also considered as an optical phenomenon that which is visible in our eye, is called as gnarled enamel. So now this gnarled enamel are especially some structures which you see in the incisal edges or the cuspal tips, where these enamel, the millions of enamel rods, when they come onto the cuspal edges, it will all converge to one point, and this will all coalesce together, and it will intertwining of this enamel rods will happen, and it will twist and turn in this cuspal tips and incisal edges, and it will create an optical phenomenon to the eyes which is considered as gnarled enamel. And this is another microscopic structure, especially when you see in reflected light. These are called as Hunter-Sugar band. Now, Hunter-Sugar band again is an optical phenomenon. This is exclusively seen under reflected light. Now, where you will see, as you see in the picture, you can see dark and light lines. So white and black, or dark and light lines, alternating lines. Now, the alternating lines, where the light lines are called as parazones and dark lines are called as diazones in the enamel. This is an optical phenomenon, occurs due to change in the direction of enamel rods. Because of there is a change in direction of enamel rods, when you take a longitudinal section, and if you look under a reflected light, you will see an optical phenomenon like a black and white lines. Now, these originate from DEJ, and it will end a little bit short from the surface of the enamel. It will not extend till the enamel, as you see in the picture. It will start from the DEJ. You can see clearly the white and dark bands, but it is not extending towards till the outermost surface. And it is best seen under reflected light. So the Hunter-Sugar band is alternating light and dark bands, which is considered as an optical phenomenon, where the light bands are called as parazones and the dark bands are called as diazones. Now, another few ultramicroscopic structures which you will see, those are separate topics. Maybe we can take it as a separate topic as such. But there are some lines which are called as incremental lines. Now, what are incremental lines? These incremental lines are lines which denotes the incremental deposition of the enamel from the ameloblast. So, as you all know, if you have learned amelogenesis, that is a formation of the enamel is always secreted or deposited as small increments. From the Tom's process, the small increments just project out in a specific directions, and these soft tissues are being eventually getting mineralized. So that is how it happens. So whenever an ameloblast secretes a set or an increment of enamel proteins, then it takes a point of rest. It will rest for some time, and then it will retract down and then again secrete another increment. So now these time of rest is denominated as incremental lines. Okay. So in enamel specifically, the incremental lines are called as the striae of Retzius or incremental lines of Retzius. With this, I'll just stop with this class. That is a discussion of a short topic about ultra microscopic structure. The incremental line separately can be dealt in a separate class. Okay. Thank you.